Now, while we are discussing these ocular pathologies or the diseases and the abnormalities that are related to the eye, one should know what is basically the ocular OPDs are famous for or are distinct for. What are the common diseases or the illnesses that we usually come across when we're doing the ocular OPD or the ophthalmology OPD? So usually the diseases that are related to the different anatomical structures that we've already dealt in or studied are the cornea, then we have the sclera, we have the eyelids, we have the eyelashes, we have the inflammations of the meibomian glands, we can have the outgrowths out there. For example, there is an outgrowth which is known as pterygium, and it basically causes an irritation to the eye. So one should know how to go about and manage these cases. The most common of them all is the visual acuity that we usually come across. So how do we go about and basically document this visual acuity? There are different tests that are sorted for the determination or the evaluation of the visual acuity or the clarity of the vision in a person. So one should know these techniques that are commonly used using the Snellen's charts and then the usages of the Ishihara's charts that are specific for the calculation or the evaluation of the color blindness in the individuals. So all of these documentations are again very important. The range of diseases that we've already discussed, ranging from the keratitis, the corneal ulcers, the keratoconus, the decrease in the visual acuity, presbyopias, we can have the retinal detachments, strabismus. All of these diseases have their different rates of epidemiologies, their different rates of prevalences and incidences according to the population or according to the areas that we have calculated or researched upon. So we'll be discussing all of these epidemiologies over here, or we'll summarize them over here in this section just to get the background knowledge of the different ocular diseases. Then when are these diseases most stressful, when they're causing blindness in these individuals? The most dangerous out of these diseases are the ones that can cause blindness. So the knowledge about the blindness and what are the different causative factors, what are the different risk factors that can lead to blindness is again very important, and we'll be discussing that over here in this section. And then we'll move on to the different prevalences and the incidences of the blindness, and as well as the blurred vision or the decrease in the visual acuity. When we talk about blindness, what are the different factors that can be involved over here? It can be the cornea, it can be the sclera, it can be the pupils, and as well as it can be the neural factors or the optic nerve can be involved. Then we can also assess the retinal health. That is again very important to make that image out on the fovea and the macula. And then again, the cerebellar or the occipital interpretation of the messages is again very important over here for the clarity of the vision, for the clarity of the messages that are sent back by the optic nerve. So this is the main cause or the leading causes. Now there are different causes that can affect the optic nerve. There are different causes that can affect the occipital nerve, and they basically range from the infections, inflammations, and as well as traumas. Direct traumas can again affect these areas and can result in the blindness of the individuals. So over here, when we talk about the objectives of epidemiologies, it's the basis is to establish the incidence and the prevalence of the eye disorders that cause the vision impairment or the blindness, to determine the societal impact of vision loss. So what are the post-blindness effects on the society is again very important. It can range from the psychological factors towards the physical disabilities of the individual. They can hinder his or her day-to-day activities. Assess the potential and the real impact of the preventive and treatment effort for the eye problems. Now, the causes of the blindness. 85% of blindness is in Africa and Asia. 85% of the causes are potentially treatable or the preventable causes that we can talk about over here. So when we have a look over here at this tabulated form. Cataract can be caused by all of these causes. It can range from trachoma, that is affecting almost 6 million of the population. Glaucoma can one of the causes. It is almost affecting 3 million of the population. Xerophthalmia, that is the dry eyes, is one of the causes, and it is affecting 0.5 million of the population and is causing blindness in 0.5 million people around the world. Then we have the macular degeneration, which is again causing 1 million people getting blind at the end. Diabetic retinopathies, almost promoting 0.25 million people are affected by blindness. Leprosy is one of the causes as well. Almost 0.25 million people are affected over here, and other causes are 2.5 million people, which can range from the miscellaneous causes. It can also include the trauma. So over here, you can see that cataract is the most leading cause over here that can result in the blindness of the individual, and that is followed on by the infectious causes ranging from the trachoma and glaucoma. So these are the top 3 factors that can end up in the blindness of the individual. So we have to be very careful if we get a disease of that kind. One should be very vigilant to treat cataract, glaucoma, or trachomas. Then just having a look at the prevalences, it's almost 0.125 and 0.25% in the Western world, 0.2 to 1.5% in Asia, 0.3 to 3.1% in Africa. And then looking at the incidences, the prevalence in Germany is almost 15% loose sight, 51% loose sight as well. That is basically ranging from almost more than 50 and less than 80 years old. And then we have 15% loose sight, and that is most prevalent in people who are more than 80 years old. So the incidences, if we have a look at it, 50% of new cases are people over 80 years of age. So this is the common incidence that is seen quite commonly. The imbalance due to the differences in the life expectancy and duration of the blindness. Blind is usually less than 10 years, is almost 74%. And more than 10 years, it's 26%. And for more than 20 years, again, it's almost 10%. Now, when we define vision, it's basically the central visual acuity or the clarity of the vision is regarded as vision. If it is uncorrected and whether it is corrected, you have to document it like that. And then you have also going to add on the refractive error, the definition of myopia, that is basically the farsightedness is known as myopics. This usually the young people are myopics. And then we have the Snellen's chart and the ETDRS charts that are used clinically to evaluate the visual acuity in the individuals. You can see over here that we have the Snellen's charts. Letters over here are known as the optotypes, and the patient is asked to stand at a distance of almost 6 meters, and he's asked to read the lines accordingly, and then it is noted down whether when he has stopped reading, you're going to note that line down. So that is basically that is how you're going to assess the visual acuity in these individuals. So in this section, basically, we summarize the epidemiology regarding the ocular pathologies. So that is the end of this section. Thank you for watching sqadia.com.